Hello students, today we are here with the subject psychology. I am Chris Thomas who is going to teach you about psychology, which is very important subject for first year BSc nursing. You know what are the objectives of this subject? This is mainly made to acquire knowledge about psychology, behavior of self as well as patients. The units covers are introduction of psychology, biology of behavior, cognition, motivation and emotional process, personality, developmental psychology, mental health and hygiene, and at the end you have assessment of various psychological tests. So let us move towards the first unit, that's about unit 1, which speaks about introductory part. The contents covers are history and origin of psychology, definition and scope of psychology, relevance to nursing, as well as which are the methods of psychology. History of psychology. You know, every subject have some or other history, right? So in the same way, psychology also have history, but it does not have very long history. But definitely, you know, when the human being are born, that time itself they are born with their own psychology. So you'll see some basic foundation behind the subject. And it is been said that in 16th century it has been encountered as the first time. Let's see about history, about medicine. You know, since we are from nursing field, so we belongs to medical fraternity, right? So who is father of medicine? Who is considered as Aristotle? So Aristotle is father of psychology, father of medicine before 30 BC, and he was a great philosopher. Along with medicine, he has learned something about psychology like learning, memory, motivation, emotion, perception, and personality. And why he studied about psychology? Because something is attracted to his mind when he was studying about medicine. He classified our body humors. And what is this term body humors? According to this theory, he said that human body is composed of 4 basic substances which are known as humors. They are very balanced when the person is healthy. That means these 4 humors are very necessary for our body, and if these 4 substances are in balance, that means we are healthy, according to Aristotle. Sorry, I am telling about Hippocrates, not according to Aristotle. Okay, so we can just see what happens as per this slides. It is been mentioned that if any of these humors get deficit, I mean if out of this 4 any 1 or 2 is getting lack or deficit, then there is imbalance. So Hippocrates speaks about this. Total 4 humors. The first one is about blood and sanguine. The second one is about phlegm and phlegmatic. And third is about black bile and melancholic. And last is about yellow bile or choleric. You can see in the image, even they are mentioned about hot, wet, cold and dry. I'll explain about this because these are the personalities. The 4 humors like blood belongs to air, phlegm belongs to water, yellow bile belongs to fire, and the end black bile belongs to earth. सबसे पहले हम देखेंगे what is about blood or sanguine humor, because you know blood is in red color, right? As in the image also you can see how this is shown as in red color. Also in psychological terms, as he has mentioned about sanguine, and this sanguine is why it is known as this blood or sanguine, because it is hot or wet or warm and moist. You can see in the image like how this is hot as well as wet. So blood belongs to hot as well as wet, right? So as he says, it promotes a feeling of joy, optimism, enthusiasm, affection, and well-being. So according to this theory, he says, this is like if the person is very happy, he feel very optimistic, like हर काम में उसको आशा लगता है, so there is no any depression, so such conditions, and he is very enthusiastic as well, so such condition, that personality belongs to sanguine. दूसरा जो है that is about phlegm, or we can known as phlegmatic humor. Phlegmatic humor, what it indicates, it is like our plasma. You know, when the blood takes like where they are divided into two parts, like blood cells as well as the plasma. So same way, this clear plasma portion, it is like a cold and wet. You can see in the image that phlegm is about. I'll just show with this part. So this is about like wet as well as cold. This is phlegm, right? So these both are either wet and cold. So personality is like a mixed personality, like cold personality and wet personality. That indicates the person is very passive, not active. लिथार्जी का मतलब होता है इनएक्टिव रहना, बिल्कुल एक्टिव नहीं रहना, वीक रहना. Then, but at the same time, some positive emotion is also belongs, like devotion, sentiments. So that is about phlegm. Next is about yellow bile or choleric humor. So what it indicates, you can see here in the choleric humor, it is like hot as well as dry. So can you imagine in such climate also we cannot live very enthusiastically, right? So that is why this is known as yellow bile or choleric personality. So in the yellow bile, it is a substance in our body, and the personality as per this theory is about choleric humor. Like in our bilirubin, you might have studied in your anatomy and physiology about bilirubin and the bile. So how it is like they helps for our body, and it is hot and dry. If bilirubin level is very high, then the person considered as a jaundiced person, like hyperbilirubinemia. So the same way, that is why he has considered this as a yellowish color. And the main tendency of this personality is like anger, irritability, boldness, ambition, jealousy and courage. Mixed feelings again, right? Because it is hot and dry. So in the anger, सच पर्सनालिटी, अगर जो जल्दी गुस्सा आता है किसी को, सो सच पर्सनालिटी को हम कॉलरिक पर्सनालिटी कह सकते हैं, बिकॉज दे हैव मोर अमाउंट ऑफ दैट सब्सटेंस, देयर सब्सटेंस विल बी लिटिल हाई कंपेयर टू अदर सब्सटेंस, राइट? और दे आर वेरी इरिटेटेड पर्सनालिटी, एट द सेम टाइम एम्बिशियस बहुत है, और एट द सेम टाइम दे हैव जलन बहुत होता है उनको, करेजियस भी है. मतलब एक तरीके से हम देखा जाता है तो इट इज लाइक अ मिक्स टाइप ऑफ फीलिंग्स. At the end, we have the humor is about black bile or melancholic humor. So black bile or melancholic, you can see in the image, it is mentioned here very clearly about how this black color or this, it is written in a black color, right? So this is a dry as well as cold. So that is black bile. So here the personality is known as melancholic. Maybe in your third year, you will study in psychiatry about a disorder known as depression. एक बीमारी है डिप्रेशन, तो उसके अंदर पेशेंट को मेलानकोलिक डिप्रेशन करके एक टाइप होता है. सो मेलानकोलिक डिप्रेशन में होता है पेशेंट बहुत अनईज फील करते हैं, दे फील लाइक आइसोलेटेड, दे फील लाइक अ सोशल विथड्रॉल एंड वेरी मच डिप्रेस्ड, होपलेस फील होता है उनको, वर्थलेसनेस होता है, एंड दे ऑलवेज फील लाइक आई एम हेल्पलेस ऑल्सो, नथिंग आई कैन डू, नोबडी इज देयर टू हेल्प मी, in that condition. So there the person have melancholic type of personality. So they are very cold and dry. At the same time, something they are like a cautious, wisdomatic as well as realistic. So this is about the theory. Another theory is about, means since we are dealing about psychology introduction, about history. So there are many histories. So unless until आप जब history आप नहीं जानते हैं, you cannot read or you cannot study, because knowing history is very important, right? So next is about Socrates. Socrates का जो study ये कहता है, mind is like a soul. What is soul? Soul को हम हिंदी में कहते हैं आत्मा. So आत्मा को जानना is psychology as per Socrates. Then he has studied about thinking, imagination, memory. ये सब बहुत सारा cognitive process है, हमारे यूनिट 3 के अंदर भी है ये यूनिट. सो उसमें भी आप डिटेल में आप सीखोगे थिंकिंग क्या होता है, व्हाट इज मेमोरी, व्हाट इज ड्रीम्स, how we can learn something. And further his pupil like Plato and Aristotle. So Aristotle was his pupil. Pupil ka matlab hai student. So they also taught about like why can't we apply Socrates' idea? So they just took the idea of Socrates and they just thought psychology is not only study of soul. उनके हिसाब से सिर्फ आत्मा के स्टडी नहीं है साइकोलॉजी, तो उसमें दे हैव जस्ट कंसिडर्ड ह्यूमन बीइंग, or we can say ability of reasoning ability of human being, and they said that human being is like an animal, rational animal. Rational animal मतलब rational का मतलब होता है हर चीज़ों में reasons ढूंढना, कारण ढूंढना. So animal इस टाइप का creature होते हैं. So human being belongs to such character. So these are some theory like René Descartes, another psychologist. You can see the dates also which is mentioned here. They are not like very good, noted psychologists, but some or other contributions are there in about them. They said that body is like automobile engine. उनके हिसाब से अपने body एक type of automobile engine है, and they carry on its work without the supervision of soul. Hence, the body and soul are separate. You know, as per this theorist, he is telling that body अलग है, अपना आत्मा अलग है, दोनों अलग अलग है. तो एक ऑटोमोबाइल इंजन की तरह काम करते हैं बॉडी बिना सोल. सो दे जस्ट स्टडीड एंड दे जस्ट लेफ्ट, एंड सम अदर थियरिस्ट आल्सो केम. But before moving into some more introduction, I just want to make you more aware about the definition. Before going into definition, let me ask you, or you can just introspect yourself. खुद से भी आप पूछ सकते हैं सच में ये सब्जेक्ट कितना जरूरी है हमें. Why we need to study this? Because psychology is a study to understand about mind or spirit. Is a Greek word, you know, that is psych and logos. दो terms से create किया है. That is I'll just explain about basic two parts, that is psych and logi. So let us see what is psych. Psych का मतलब है soul. This is known as soul. सोल को हम हिंदी में आत्मा कह सकते हैं. बहुत सारे डेफिनेशंस आज तक लोगों ने दिया है. स्टिल पीपल आर स्टडिंग, सर्चिंग अबाउट मोर फाइंडिंग्स इन वेरियस स्कूल्स ऑफ थॉट्स आर देयर. सो दे आर टेलिंग डिफरेंट डेफिनेशंस, एंड लॉजी मीन्स स्टडी. So simple meaning is study of soul, or we can also known as study of mind, right? So let us see another definition. It is the study or science of behavior of organism and its mental process. एक ऑर्गेनिज्म मीन्स ह्यूमन बिहेवियर आता है उसके अंदर, एंड उस बिहेवियर को सीखना, समझना, दैट इज द डेफिनेशन ऑफ साइकोलॉजी. ओके, लाइक बिहेवियर डज नॉट मीन दैट ओनली साइकोलॉजिकल एस्पेक्ट. बिहेवियर कैन बी इंक्लूड एनीथिंग व्हाट वी आर रेस्पॉन्डिंग टू एनीथिंग. माय रिस्पॉन्स टू दिस स्टिमुलाई, राइट टाइम आई एम बिहेविंग वेल बिकॉज आई एम टीचिंग यू. सो मेरा बिहेवियर है एक अच्छे तरीके से आपको क्लास लेना, सो दैट इज माई बिहेवियर, राइट? तो सेम वे व्हाट आई एम शोइंग, what I am doing, what I daily base पे करता हूँ, so everything belongs to your behavior. Simple example यहाँ पे दिया है like motor activities. Motor मतलब related to your movement, your muscular activities like walking and speaking. और cognitive activities. Cognitive activities मतलब perception, perceive करना, कोई चीज को accept करना. Now like this is an app. You are learning from this app about subjects, various subjects. So you are pursuing some new knowledge. You are getting some virtual knowledge. रिमेंबरिंग, फिर मेमोरी पावर, याद रखना कोई चीज को, और हाउ वी आर थिंकिंग, वेदर यू आर थिंकिंग राइटली और पॉजिटिवली और नेगेटिवली. सो दैट टाइप ऑफ थिंकिंग, अपना सोच, और रीजनिंग पावर एंड आवर इमोशन. Human being is filled with different types of emotion. Human being is the only creature we know because उसमें सबसे ज्यादा emotions होते हैं. Happiness रहना, sad रहना, because we are mixed with positive as well as negative emotion. So overall this type of behavior every individual have, and this study we can known as psychology. And you know, psychology is very important to understand our patient. We are belongs to health field, we are belongs to medical background. So as a nurse or being a nurse in your hospital, it's very essential you should deal with patient's behavior. और आने वाले समय में in as per I think WHO also has said, आने वाले समय में WHO ने ये कहा कि सबसे ज़्यादा जो बीमारी इस दुनिया में जो होगा that's about depression. And depression was a symptom very before, but now it is a major disorder because depression इसलिए होगा because of some other condition. If I am having cancer, so that is a physical issue. But along with my cancer, मेरे साथ मेरा depression भी पैदा होता है. So such type of conditions deal करना बहुत मुश्किल है. So we need to understand the patient's behavior in which conditions they belong to. For that purpose, we need to understand psychology. So another some more further definitions have been given, like it is regarded as a study of mind or mental process. Same definition है because काफी लोगों ने जब definition दिया they were unsatisfactory. So they are still studying. They said that mind as an object which does not exist. What exists is only brain. This is just study. Okay, I am not telling or I am not fixing it. मैं इसको fix नहीं कर रहा हूँ because this is the individual research, individual study, because they are telling that it is like a mind and body does not have any connection, but somebody is telling it is a functional unit of brain. But if I am asking you where is mind, mind कहाँ पर है? अगर मैं आपसे पूछा जाएगा तो where you will show me. So those part also I will show in your further units. Don't miss that unit also in your unit second. It's about mind, behavior, how we can differentiate both things. Okay. I think you are interested to this subject because this is very interesting subject. When we deal with such subject with patient, you will get more chance to understand. Then another thing is about science and behavior. You know, science and behavior, these two are very important field because science field के अंदर ही हम काफ़ी चीज़ें हम सीखते हैं. And after all, we all have comes under the faculty of science. So साइंस विच लाइक अ ग्रुप ऑफ फैक्ट्स और प्रिंसिपल्स, जिसमें थियरीज होते हैं, लॉ होता है. आपने फिजिक्स केमिस्ट्री के अंदर यू हैव लर्नड राइट कि डिफरेंट टाइप्स ऑफ लॉ, न्यूटन्स का लॉ आपने पढ़ा है और एनी टाइप ऑफ हायरार्कीज आपने पढ़ा है. सो दोस ऑल थिंग्स आर फैक्ट्स और सम थियरीज एंड व्हेन वी प्रूव इट एंड वी आर एक्सेप्टिंग इट, कोई भी चीज़ को हम प्रूव करके हम एक्सेप्ट करते हो, दैट इज साइंस. इट इज अल्टीमेटली बेस्ड ऑन फैक्ट्स. And what exactly is behavior? Already I told you, it's about our remembering, our happiness, our thinking, our all emotions, our activities, whatever I am responding to the any stimulus. कोई भी stimulus के लिए मैं कैसे respond करता वो मेरा behavior है. So ये दो चीज like science and behavior both are directly interrelated to the psychology. So that is another terminology. Next is about birth of psychology. You know, this person is known as Wilhelm Wundt. Okay, here H is silent, or you can pronounce like anything, Wilhelm or Wilhelm Wundt. He is considered as the father of psychology. कभी कभी ये competitive exams में आपसे पूछ सकते हैं who is father of psychology, and if the option have this Wilhelm Wundt's name, definitely you have to tick mark on that. Because some books, some theories or some books are still in confusion who is father of psychology, because some theories have came before Wilhelm Wundt. Like Sigmund Freud एक another father है psychoanalytic theory का, तो कभी कभी उनको भी माना जाता है. But in many other books I have found Wilhelm Wundt as the psychology father. And in 1879 Leipzig, Germany, he has been born, and he make this subject as a very reputable subject as a science, and many American psychologists eventually went to study about this. अब इन्होंने क्या स्टडी किया है वो हमें जानना जरूरी है. लाइक इनका स्टडी जो था सबसे इंपॉर्टेंट वाज अबाउट सेंसेशन एंड परसेप्शन, बिकॉज ही जस्ट थॉट सेंसेशन दैट मीन्स आवर सेंस ऑर्गन्स. हमारा 5 सेंस ऑर्गन है राइट, like our smell, so that is our nose, our tongue, so that is for our taste, our eyes, our vision, our ear, our hearing capacity, and ultimately our touch, that is our skin. So these 5 sense organs have some more connection with psychology. Again I'm telling this explanation also will be there in your further units. And he also told about perception, and he did not think that high order mental process could be studied experimentally. High ordered mental process सब कुछ हम experiment के through नहीं कर सकते हैं. So those studies was also there, and he was a doctor because he has been trained for medicine as well as philosophy, right? So इनका जो study था सबसे important था about introspection. Intro So you know what are the meaning for this subject. Okay, so intro. Again, I am repeating that term for you. So introspection, I can divide this subject into two. You can separate this. Intro का मतलब होता है internal, अंदर की बात. Okay, so how we can study about this subject as per him, because he said that introspection means you have to study yourself first. सबसे पहले खुद को हमें समझना चाहिए, then only we can understand others. So that was his study. Then some more history was there. Some school of thought have given different type of studies. So that is not that much important for your syllabus. I'm just showing the slide. You can note it. And some more school of thoughts have studied about structuralism. Structuralism was also an idea of Wilhelm Wundt. अभी हमने देखा Wilhelm Wundt के बारे में. He is the father of psychology. And उनका जो student था Edward B. Titchener. So he has also studied about structuralism. Structuralism is about units or elements which make up the mind. Because they said that every human being has some more elements in our mind, and that is known as introspection. So अभी मैंने जो पढ़ाया आपको introspection, like intro means about inside, अंदर की बात हमें करना चाहिए. So when you study about yourself, you can study others also. So that was structuralism, structure of mind. Next is about Gestalt psychology. Another German psychologist was Max Wertheimer, and some of his colleagues, they have studied about this, and they said that they are just against about structuralism. They were like wrong in thinking of mind as being made of elements. So they just thought mind could be thought as of resulting from whole pattern of sensory activity and relationship and organization within its pattern. They were just against that behind theory, like we have seen in the behind slides about structuralism, right? So वो बिल्कुल against थे उनके, like उन्होंने कहा कि सबसे पहले खुद को जानो, अपने mind को जानना चाहिए. But ये just कहते हैं कि because you cannot study about your mind, we have to just understand about the whole system of the human body, like how we are related to each other. So that pattern, that whole pattern. So Gestalt का मतलब is also same way. We call Gestalt as whole pattern. So I'll just show one like writing in that, so you can understand more about Gestalt theory, like whole principle. Whole का मतलब है सब कुछ, complete. So complete human being belongs to Gestalt psychology. Next is about functionalism. John Dewey, James R. Angel, Harvey Carr, इन्होंने कुछ कहा है कि what mind and behavior do. बिकॉज माइंड एक पार्ट है और बिहेवियर, सो दोनों का जो जॉइनिंग जो है इसी को हम फंक्शनलिज्म कहते हैं. बिकॉज द फंक्शन ऑफ द बॉडी, लाइक अगर आप अभी सीख रहे हैं, सो दैट इज द फंक्शन ऑफ योर बॉडी. मेमोरी, कोई चीज़ हम याद करते हो, मेमोरी पावर. और कोई चीज़ को हमें सॉल्व करना है, व्हेन वी आर इन कोई मुसीबत में है, कोई प्रॉब्लम में है, हाउ वी आर सॉल्विंग दैट प्रॉब्लम सॉल्विंग स्किल, सडनली इट कम्स इन योर माइंड, इन योर बॉडी, इन योर बिहेवियर. सो दैट नेचर इज ऑलरेडी देयर विथ अस. एंड आवर मोटिवेशन टू डू एनीथिंग, इट कुड बी इंटरनल मोटिवेशन और योर एक्सटर्नल मोटिवेशन. I'm guessing that you are understanding what I am saying. And next is about behaviorism. That was about John P. Watson. वाटसन्स का थियरी वैसे भी काफ़ी इंपॉर्टेंट है, काफ़ी साइकोलॉजिस्ट में आगे भी है, इन्होंने सपोर्ट किया है बिकॉज ही ऑलवेज स्टडीज एक्सपेरिमेंट विद एनिमल्स. सो इन्होंने जस्ट रेस्ट्रिक्ट किया द स्टडी ऑफ एक्टिविटीज इन एनिमल्स एज वेल एज पीपल. Next is very important because this is the basic theory of psychology, that is Sigmund Freud's theory. Sigmund Freud ने ये कहा है कि एनालाइज करना, साइको एनालिसिस. और जैसे मैंने आपको कहा, इन योर थर्ड ईयर यू विल लर्न अबाउट स्ट्रक्चर ऑफ साइकोलॉजी, आई मीन स्ट्रक्चर ऑफ माइंड. नॉट इन थर्ड ईयर, इवन फर्स्ट ईयर साइकोलॉजी में भी है, क्योंकि थर्ड ईयर यू हैव अ सब्जेक्ट नोन एज साइकेट्री. तो साइकोलॉजी और साइकेट्री में मेन फर्क ये है, साइकोलॉजी यू आर अंडरस्टैंडिंग ए ह्यूमन बिहेवियर, एक नॉर्मल बिहेवियर को. लेकिन साइकेट्री जो सब्जेक्ट है जो थर्ड ईयर में आप सीखोगे, दैट इज अबाउट टू अंडरस्टैंड द अपनॉर्मल पार्ट, जो डिसीज पार्ट. अगर आपने ह्यूमन बिहेवियर ठीक नहीं है, नॉर्मल नहीं है, जब हम अपनॉर्मल हो जाते हैं, यू विल बिकम मोर इल, मेंटली आप अनस्टेबल हो जाओगे. सो दैट कंडीशन को सीखने के लिए हमारा साइकेट्री सब्जेक्ट है. तो deal psychiatry, you must know psychology subject. So according to him, he is also have some theory about behavior and mind, and he has studied about structure of that mind. So anyhow, we will just skip here because this is not here in this chapter. Further chapters में I will again detailed about this psychoanalysis, because as I said ये unit 1 है, सिर्फ इंट्रोडक्शन है आपको, सो इंट्रोडक्शन के बाद ही हम देखते हैं इसको. And these are some major landmarks in the development of psychology. You can just see, you can just note down. I am not going to tell about this date or this major landmark. Like विल्हम वुड ने कब उसका उनका जो फर्स्ट साइकोलॉजिकल लैबोरेटरी बनाया, then other different theories का like Sigmund Freud का, even Pavlov, John Watson, and even some more other like Carl Rogers theory is very important. Carl Rogers theory जो है वो काउंसलर है, उन्होंने काउंसलिंग के बारे में समझाया. then B.F. Skinner, Abraham Maslow, then Leon Festinger. so बहुत सारा ऐसा लैंडमार्क है साइकोलॉजी के अंदर, and we should learn about this. just an exercise, okay? Can you just read this? यहाँ जो लिखा है आप पढ़ सकते हो उसको. At a glance जब आप देखोगे उसको पढ़ना थोड़ा मुश्किल है, right? But not so मुश्किल also. बहुत ज़्यादा मुश्किल भी नहीं है और बहुत ज़्यादा easy भी नहीं. But definitely you can read this. Read. This is because the human mind does not read every letter by itself, but the word as a whole. Amazing, right? So human being or human mind को read करना is not so difficult, but it is not so easy also. So this was just an exercise. Just skip this because continuous studying also is very boring, right? So बीच बीच में हम ऐसा activities भी करते रहेंगे. Okay? So अभी हमने देखा how to understand the history of psychology, right? So next we'll see about scopes or branches or subfields of psychology. You know, कभी कभी ये question आता है, what are the scope of psychology or what are the branches या फिर what are the subfields of psychology. So in different types of questions you can lead. So basically they are divided into two types. The first one is about pure branch and the second one is about applied branches. So pure branch, सबसे पहले हम देखेंगे about pure branches. Pure का मतलब है बिल्कुल impurities नहीं है, because they don't have any mixing, they don't have any other thoughts, they have their own branch. Okay, so here there is principles, theories, and they have suggesting some different types of behavioral assessment. So different principles, behavior को जानते हुए they have made this type of psychology. The first branch is general psychology. तो जनरल फील्ड का भी साइकोलॉजी है, लाइक वी आर ऑल्सो स्टडिंग साइकोलॉजी, बट यू नो देर आर डिफरेंट टाइप्स ऑफ कोर्सेस, लाइक BA साइकोलॉजी है, BSc साइकोलॉजी है. सो दे आर डिफरेंट फील्ड एंड दे बिलोंग्स टू सम और अदर ब्रांचेस. तो वन इज अबाउट जनरल साइकोलॉजी वेयर यू आर डायरेक्टली डीलिंग अबाउट जनरल पैटर्न ऑफ अ ह्यूमन बिहेवियर, लाइक sensation, perception, emotion, learning, intelligence, learning. These all are basic qualities of a human being, and this is very important for understanding generalized. Next is about physiological psychology. अभी आपने anatomy physiology का भी क्लास पढ़ा है, right? So physiology क्या है? To understand the function of the body. At the same time, how we can connect this physiology with psychology is also very important. You know, because brain को समझना, nervous system को समझना, then the cognitive factor, connective factor, this all are comes under this branch, because everything is belongs to your brain, like psychology also speaks about that. So that brain और psychology में क्या connection है, और some glands, some hormones also have some connection. उसके लिए हम physiological psychology सीखते हैं. Next is about developmental psychology. In the image also we can see development. Development starts when we are getting into life, like after our birth. वहाँ से हमारा development, growth and development start होता है, like your childhood, your adolescence and your old age. You can see in the diagram, right? There is a child, there is a man, then there is a different family, and finally there is a old age man. So that development, each developmental stage will have different types of psychology, because I will explain this part in the developmental psychology. वो भी एक अलग यूनिट है, because उसके अंदर है जैसे कि एक छोटा बच्चा है, so उनके अंदर किस तरह का बिहेवियर है, that is ultimately different from an adult or an adolescent. सेम फॉर एन ओल्ड एज, बुजुर्ग लोग जो है तो उनके अंदर किस तरीके के बिहेवियर है वो हम चाइल्ड के बिहेवियर के साथ कंपेयर नहीं कर सकते. सो टू अंडरस्टैंड एवरी बिहेवियर इज वेरी इंपॉर्टेंट. तो उसके लिए हम डेवलपमेंटल साइकोलॉजी या फिर उसको हम जेनेटिक साइकोलॉजी भी कह सकते हैं. नेक्स्ट इज अबाउट चाइल्ड साइकोलॉजी. जैसे अभी मैंने कहा टू अंडरस्टैंड अबाउट द चाइल्ड. सो चाइल्ड लाइक बर्थ टू एज ऑफ 12 considered in the childhood because after 12 years our puberty belongs to, है ना. सो कभी कभी ये होता है कि आजकल 11 years से puberty start हो जाते हैं, या मे बी आफ्टर puberty you can consider as an adolescent age group, but still we consider this as a child till 12 years. तो चाइल्ड का जो साइकोलॉजी को हमें सीखना है उसके लिए चाइल्ड साइकोलॉजी है, एंड दोस हु डील विद चाइल्ड साइकोलॉजी दे आर नोन एज चाइल्ड साइकोलॉजिस्ट, या फिर काउंसलर्स भी होते हैं, चाइल्ड काउंसलर्स. नेक्स्ट इज अबाउट एनिमल साइकोलॉजी. लाइक इन मैंने सम कुछ थियरीज आपको कहा, लाइक वाटसन्स थियरी, उन्होंने एनिमल के साथ काफी एक्सपेरिमेंट किया, लाइक इवान पावलोव है, or some many theories are there in psychology. They have learned everything with the human behavior because man is a rational animal. So सबसे पहले ह्यूमन एनिमल्स के साथ उनका एक्सपेरिमेंट हो गया, उसके बाद वो ह्यूमन बीइंग के साथ एक्सपेरिमेंट किया. सो इसलिए एनिमल का साइकोलॉजी जानना भी जरूरी है. सो विच ऑल एनिमल्स दे हैव बीन यूज्ड, लाइक रैट्स है, डॉग्स है, पिजियंस, गिनिया पिग्स, कैट्स, दिस आर द कॉमन एनिमल्स विच आर बीन यूज्ड. और आज के तारीख में एनिमल्स के ऊपर ज़्यादा साइकोलॉजी एक्सपेरिमेंट नहीं होते बिकॉज मेनी आवर एरिया ऑफ रिसर्च हैज़ बीन वाइड स्प्रेड एंड देयर आर गुड स्कोप ऑफ डूइंग रिसर्च इन human being also. So nowadays people do directly on human being these type of researches. Next is about abnormal psychology. As I said about abnormal psychology, like various kind of mental disorders, maybe your cause, your symptoms, your treatment. Like मैंने आपको कहा है about साइकेट्रिक डिसऑर्डर, लाइक तो साइकेट्रिक डिसऑर्डर में भी यही है कि साइकेट्री बेसिकली बिलोंग टू योर अपनॉर्मल बिहेवियर डिसीज ओरिएंटेड है. साइकोलॉजी बिल्कुल आपका नॉर्मल बिहेवियर ओरिएंटेड है. तो साइकेट्री के अंदर हम अपनॉर्मल पार्ट देखते हैं. किसी को मेंटली अगर वो बीमार है तो क्या बीमारी है उसको जानने के लिए दिस साइकेट्री फील्ड वर्क्स. सो वो आप थर्ड ईयर के सब्जेक्ट है आपके वैसे भी. सो बट हियर यू विल लर्न इन द अपनॉर्मल साइकोलॉजी ऑल्सो. Next is about social psychology. So social psychology, you can see the image, how people are belongs to each other. Without social life, we cannot live, right? We all belongs to something. We all are interdependent to each other. For example, if I am taking class, तो मुझे सामने students चाहिए. So that I am dependent to my students. और अगर students को teacher चाहिए, so students are dependent to teachers. So that means we are very much socialized to each other. So that is why it is known as man is a social animal also. So to deal with the social aspects, social part, cultural study, social psychology is very important. Next is crime psychology. Criminals का behavior को जानना बहुत जरूरी है. मुझे याद है like when I was student, nursing student, when I was being posted in a psychiatric hospital, I think in third year or in my MSc psychiatric also, I was posted. So there what I did, like my posting was in criminal psychiatric ward, जहाँ criminals patient रहते थे जो जेल से जो आते थे बिकॉज ऑफ साइकेट्रिक प्रॉब्लम. तो उनके साथ डील करना इज वेरी डिफिकल्ट, यू नो, एंड टू अंडरस्टैंड देयर बिहेवियर, दे में व्हाई दे डिड द क्राइम, उन्होंने वो क्राइम क्यों किया. सो इस टाइप का काउंसलर कभी कभी आते थे वहाँ. सो दे यूज्ड टू कंडक्ट वेरियस थेरापीज फॉर दिस पीपल एंड टू अंडरस्टैंड द साइकोलॉजी. सो सच फील्ड के लिए इट इज वेरी मच स्कोप, आजकल बहुत ज़्यादा स्कोप है फॉरेंसिक एज वेल एज क्रिमिनल फील्ड ऑल्सो. And next is about military psychology. Military people, because they are our savers, they are saving our country. Our देश के लिए सबसे ज़्यादा important people है soldiers, like military people. But they also face many difficulties during their life at military, like in their life, because they are leaving their family. They already left their family and they are just leaving for nation. They are sacrificing their life. So some or other way they have to deal very detailed. I just remember one of my friend who is a soldier. So he always used to tell. Now he is in a good post, but he was like an administrator. So he just said me, Under him there are 200 to 300 soldiers, and he has to take care their psychology. Very difficult, because they are away from family. Sometimes family calls and some issues comes and they have to deal, and it is not so easy. And at the same time they have to save the nation, save self, save nation, save others. So overall they get disturbed, right? So these things what we can do, we have posted over there also, so we can have like a different type of people over there who can counsel them, you can guide them. And even when you are recruiting any personnel to armed forces, especially armed forces, or even in our nursing also we have armed forces nursing college, armed forces medical college. So there also we get posting, or otherwise sometimes our students are also there working in AFMC. So in the AFMC armed force medical college also they have the interview. So in the interview also they are supposed to give interview based not only on the subject, sometimes they have questions based on psychology also. Like if you are in a such situation, आपका कोई situation आपको दिया जाएगा, इस situation में आप कैसे खुद को protect करोगे, ये सामने वाले को कैसे help करोगे. So some or other way some scenarios been given, and they have to understand their psychology and their thinking and their critical abilities. That critical thinking skill is very important here. So to understand all those aspects, military psychology works. And the very important part, that's about parapsychology. Have you heard about this term parapsychology? Because it is somewhat important also, parapsychology, and it depends on the beliefs, our beliefs to some system, right? Like as I said, जैसे मैंने अभी कहा आपको 5 सेंस ऑर्गन है, राइट? सो 5 सेंस ऑर्गन जो हमारा काम करते हैं, अपना आइज, योर ईयर, योर नोज, योर टंग, योर स्किन, दिस 5 ऑर्गन्स. बट इन साइकोलॉजी इसके अलावा एक और एक्स्ट्रा सेंसेशन कहते हैं, दैट इज नोन एज पैरासाइकोलॉजी. ओके, extra sensory perception or sixth sense. Even there are some movies also in Hollywood, paranormal activity. अगर आपने देखा हो तो आपको शायद याद होगा. So there also they are speaking about the sixth sense. After this fifth, then the sixth sense. But it is not in our body, but it is in our thought. It is in our mind. So let's just see about this extra sensory perception. So they are of various classification. पैरासाइकोलॉजी का वेरियस क्लासिफिकेशन है. सबसे पहला आता है क्लेयरवॉयंस. क्लेयर का मतलब है क्लियर, एंड वॉयंस का मतलब है विजन. सो क्लियर विजन, अगर आपको कोई चीज देखना है तो यू हैव टू वेरी विजनरी, राइट? इन द सेम में यहाँ पे जो मीनिंग है, हाउ टू सी समबडी, how to feel somebody, or how to place some items, anything, okay? Ability to see people, place or items. Like for example, the television. You are seeing the distant things mentally. अगर टेलीविजन में कोई मूवी आ रहा है, so we are just connecting that movie with our own life, or we are just imagining, though this is an imaginary or fictionary story, but हम just उसके अंदर बहुत deep में जाते हैं कभी कभी, right? We are become very much emotional with that. This is one type of our sensory perception. इसलिए उसको sixth sense कहते हैं. Again, some more examples are there. We may perceive at times some situation or things without help of our eyes. बिना आंखें भी हम कोई चीज देख सकते हैं. बोलने के लिए बहुत आसान है, but this is not so practical. But you just think. I give some example. A clairvoyant may see physically dead person standing beside someone who is still physically active. So अगर मुझे इस तरीके से फीलिंग्स आता है, अगर किसी का डेथ भी हुआ, मैं कभी कभी उस पर्सन को देख सकता हूँ. ऐसा मुझे कभी लगता है, मैं उस पर्सन को मेरे को वो पर्सन दिख रहा है. सो दैट इज आई कैन सी, बट ही इज नॉट देयर फिजिकली, ही ऑलरेडी डेड, बट आई हैव दैट विजन बिकॉज आई हैव क्रिएटेड इन माई माइंड. सो दैट इज वन टेक्निक ऑफ पैरासाइकोलॉजी. अनदर वन इज टेलीपैथी. इसको डिटेल में हम जा सकते हैं, बट दिस इज नॉट इन आवर सब्जेक्ट एक्चुअली, बिकॉज वी आर नॉट detailed with any more further branches, because हमें general सब कुछ सीखना है being a nurse. So I am not going in detail, but just somewhat other way I can just explain you telepathy. You also may use this word telepathy in normal way. Also we use tele का मतलब है distance, and pati का मतलब है feeling, perception, passion, experience, anything we are experiencing or something. Okay. Here we are transforming the emotion from one person to another person. Sometimes a person who is in death but remembering his close relative may be experienced by concerned person who is far away from him. Okay, this is a good example, like a dead person हो तो कभी कभी उसका याद आ जाता है और एकदम से कोई और भी उसके बारे में याद कर, सो दैट इज टेलीपैथी. इफ सपोज कभी कभी हो जाता है ना, हम जैसे किसी को कॉल कर रहे हैं, सो जैसे हम कॉल करते तो सामने वाले बोलते मैंने तो अभी जस्ट तेरे बारे में सोच रहा था, तूने कॉल भी कर दिया. सो दिस इज लाइक अ टेलीपैथी, अंडरस्टैंडिंग ईच अदर इन डिस्टेंस वे. So how you think about this subject? Is it amazing, right? Next is about psychokinesis. Kinesis आप सीखोगे, kinesis का मतलब है motion, movement, kinetic है ना. kinetic का मतलब होता है movement करना, and psych का मतलब है mind, spirit, soul. Already I told you these are different terms psychologist ने दिया है, school of thoughts ने. soul मतलब अपने आत्मा को जानना और अपने spirit को जानना, and kinesis मतलब movement. So they are just telling, as per this we can move the object even without the power of our contact. That is the mind power. Okay, that is something comes from our unconscious or maybe subconscious mind. Or you know the story of Mahabharata. तो जब वो Shakuni was there, he was just moving the dice with his power of mind when they are playing. ओके तो कभी कभी हो जाता है किसी को, जैसे अगर मैं यहाँ पे खड़ा हूँ, सो मेरे अंदर इतना पावर है, सपोज माई माइंड इज वेरी शार्प, इफ आई एम वेरी प्योर इन फ्रॉम माई कॉन्शियस माइंड और अनकॉन्शियस माइंड, आई कैन ओपन द डोर बाय सिटिंग, आई कैन क्लोज द डोर. मैं बैठे बैठे दरवाजे को खोल सकता हूँ और बंद भी कर सकता हूँ. दैट इज माई माइंड पावर. तो इस तरीके से मूवमेंट होना, दैट इज साइकोकाइनेसिस. काइनेसिस का मतलब मूवमेंट करना ऑन बेस ऑफ योर माइंड. नेक्स्ट इज अबाउट प्रीकॉग्निशन. प्री का मतलब क्या है? बिफोर. और कॉग्निशन मतलब समथिंग अंडरस्टैंडिंग. ऑलरेडी आई टोल्ड यू कॉग्निशन इज अ वेरी वास्ट टर्म एंड वी आर अंडरस्टैंडिंग इन वेरी डिटेल. आपका यूनिट 3 के अंदर है कॉग्निशन. देयर यू विल अंडरस्टैंड टू थिंक समथिंग, और आपके लिए कोई लर्निंग स्किल होना चाहिए, परसीव समथिंग. सो प्री का मतलब ऐसा सेड अंडरस्टैंडिंग बिफोर. तो अंडरस्टैंडिंग बिफोर मतलब कोई भी चीज को पहले से जानना. ओके, प्री का मतलब है before. So let us see what you are going to understand. Something, if I know something is going to happen in my future and I understand from now on. कभी कभी इंड्यूशन कहते हैं इसको. इंड्यूशन आते हैं हमारे अंदर, नोशन आता है. तो लाइक फॉर एग्जाम्पल, अगर किसी के साथ कोई एक्सीडेंट होने वाला है तो उसको पहले से ऐसा लगता है मेरे साथ अभी एक्सीडेंट होने वाला है. Okay, sometimes it happens, sometimes it does not happen also. So that precognition comes before itself, before any event occurs, he gets into that trap. So that type of power is known as precognition. Next is reincarnation. Reincarnation को हम rebirth भी कह सकते हैं, पुनर्जन्म. सो पुनर्जन्म में लोग विश्वास करते हैं, और एवरी मिथोलॉजी दे स्टडीज, मे बी मिथोलॉजीज और द साइंस. ओके, सो इफ दे हैव एनी थियरी और एनी लॉ बिलो दैट, वी हैव टू बिलीव दैट. सो रीबर्थ, समबडी वी मे टेल अबाउट कि द पर्सन इज रीबर्थ, ही इज मतलब वो किसी का पुनर्जन्म हुआ है, एंड ही वाज लाइक 20 साल पहले या 200 साल पहले वो ऐसा था और अभी उसका नया जन्म है. सो दिस टाइप ऑफ thoughts called as reincarnation, but until we don't experience, we cannot go in very detail. And sometimes it happens in the studies also. You can see many researchers are there about rebirth, like people have born and they feel that what they were before. मतलब उनको ऐसा कोई चीज याद होता है कि उनका पहला जन्म में वो क्या था और अभी नया जन्म में वो क्या है. So like they are comparing. Many research studies are there, you can search for that. And last is about contacting souls. Soul already मैंने बताया आपको, soul मतलब about आत्मा. So contact करना, contacting मतलब like how we are going to connect with souls, dead bodies, dead souls. Okay, so कभी कभी लोग काफ़ी चीज़ें यूज़ करते हैं. Again these all are religious beliefs or some or other science are also belongs to. I cannot put any comment or any assumptions on that. Only whatever is learned by some theorist, वही चीज़ आपसे मैं शेयर करता हूँ. So अगर मुझे कोई आत्मा से कॉन्टैक्ट करना है, so what are some such contact can be known as contacting souls और medium भी कह सकते हैं. सो मीडिया का अलग अलग प्लेटफॉर्म्स है, लाइक ओजा बोर्ड कहते हैं इसको, और सम और अदर. सो ओजा बोर्ड आपने कभी सुना होगा, यू माइट हैव सीन इन सम मूवीज. आई कैन शो वन इमेज हियर. सो दिस इज लाइक अ बोर्ड, एक बोर्ड इज बीन क्रिएटेड. आई जस्ट रिमेंबर in my like school college time, some of my friends they did, because they watched some movies and they just experienced it. मतलब एक टाइप ऑफ एक्सपेरिमेंट किया उन्होंने, ऐसा होजा बोर्ड लगा के, मतलब ऐसा बोर्ड बना के, लाइक यू कैन सी हियर ABCD to Z अल्फाबेट्स लिखना है उसके ऊपर, और यहाँ पे ओजा लग के लिखा. मतलब दिस इज लाइक जस्ट इमेजिनेशन, और आई हैव नॉट प्रूव्ड, और मेरे पास कोई ऐसा वो नहीं है, प्रूफ नहीं है कि आपको मैं बताए शेयर करें, बट आई एम जस्ट शेयरिंग व्हाट समबडी हैज डन और दे आर डूइंग द रिसर्च. दिस इज जस्ट फॉर योर इंफॉर्मेशन, बिकॉज दिस ऑल आर ब्रांचेस ऑफ साइकोलॉजी. सो येस, नो, एंड यहाँ पे नंबर्स भी है, गुड बाय करके लिखा है. सो एक कॉइन आता है, सो दैट दे हैव टू सिट इन ए डार्क रूम, एक अंधेरा होना चाहिए रूम के अंदर, एंड एक मोमबत्ती जला के, मतलब कैंडल हैज टू बी लिट, एंड दे हैव टू टेक वन कॉइन एंड दे हैव टू जस्ट do something, and they have to just call the soul, उस आत्मा को बुलाना है. and after some time what happens, if the any souls are present, अगर कोई dead souls वहाँ पे आसपास में अगर है, so वो ऐसा आते हैं और अपने आप वो अपना हाथ से वो coin move होगा, and they may go to like any of this alphabet. You may ask some question, आपका नाम क्या है? For example, if I am Chris, I am the dead soul, so वहाँ पे आएगा CHRIS, ऐसे एक एक अक्षर पे अपना जो कॉइन मूव होगा. सो दैट इंडिकेट दैट आत्मा who is coming there is Chris. So they may start talking and they may ask some question. Are you a good soul? Are you a bad soul? So S पे जाएगा तो good, और bad है तो no. So what are questions के लिए yes or no टेक्निक है. So बहुत सारे ऐसे टेक्नोलॉजी things are there, and science also is working over that. This is known as OJA system. So you can learn in detail, but this is not important for a nurse. I'm just telling about these are some pure branches of psychology, right? So these are the important aspect about ब्रांचेस. सबसे पहले हमने देखा टू टाइप्स का ब्रांच है. द फर्स्ट वन इज प्योर ब्रांच एंड सेकंड वन इज अबाउट अप्लाइड ब्रांच. अप्लाइड ब्रांच इज येट टू बी कंप्लीटेड. सो नाउ वी हैव कंप्लीटेड अबाउट प्योर ब्रांच. आई होप यू अंडरस्टूड अबाउट प्योर ब्रांचेस. वन बाय वन हमने पढ़ा है. ओके, राइट? सो कैन वी सी नेक्स्ट स्लाइड, दैट्स अबाउट अप्लाइड ब्रांचेस ऑफ साइकोलॉजी. So basically two branches we have seen. First was about pure branch. Next is about applied branches. Sorry. So in the applied branches, how to apply psychology in different field. So that is the exact meaning of applied branches. The first one is about educational psychology. So in the educational psychology, the learner is the focal point. This is mainly used in educational institution to understand any students or the teachers, or understanding the teaching learning process. We need educational psychologists, right? Next is about clinical psychology. They mainly focus on mental disorders, right? So already I told you mental disorders are basically different from psychology. They are belongs to psychiatry, and psychiatric field are being known as mental disorder field. So there they teach like psychotherapy, recreational occupational therapy, behavioral therapy. These all things you will learn in your third year in psychiatry subject, like how we can apply these therapy. Therapy means a treatment approach towards psychiatric patient. So like counseling. सो जैसे साइकेट्रिक ट्रीटमेंट जो होते हैं वहाँ मेडिसिन भी होते हैं, लेकिन साथ साथ पेशेंट्स को हमें काउंसलिंग कराना पड़ता है. पेशेंट के लिए वी हैव टू डू सम थेरापीज. सो ऑन दो सच टाइप ऑफ ट्रीटमेंट अप्रोच अलॉन्ग विथ मेडिसिन इट विल क्योर. And before to going to doctor or psychiatrist, they will go to clinical psychologist. So clinical psychologist का यही काम है to deal or understand the patient's exact problem, and they will guide them. Next is about industrial psychology. So you know, in the industrial psychology, human beings are very different from machines. Industry like factory हो सकता है, या wherever like in modern instruments जहाँ मिलते हैं. So those all field have some occupational issues. People may have some issues like adjustment, safety, security, financial problems. So the persons have to get into adjust with that. For there we have to understand industrial psychological aspect. Okay, so they always use this type of techniques for understanding the patient. Next is about counseling psychology. So already I told you about clinical psychology. Like for a psychiatric hospital, I told you, or psychiatric patients, they used to have a therapy session with a psychotherapist or maybe with a counselor. तो सबसे पहले काउंसलर उनसे बात करेंगे, हिस्ट्री कलेक्ट करेंगे पेशेंट का, और धीरे धीरे उनसे बात कर करके उनके लाइफ में प्रॉब्लम्स क्या है वो समझ सकते हैं, और afterwards they understand, once they understand the problems, they will just guide them, they will counsel them. So for such condition we need counseling psychology, and it should be only take place between trained counselor and the client. Client is known as counselee, those who are receiving counsel उनको हम counselee बोलते हैं, and for the person who is giving counseling they are known as counselor. So this is the difference between, this is the person who is giving the treatment and this is the patient, ये patient है आपके लिए. So this type of relationship is very essential for psychology. Next is legal psychology. The word legal means related to law, कानून. So niyam ke saath, or like law also we have to understand the behavior, like any, like as I said in the previous branch, like criminals. For criminals को समझने के लिए we need crime psychology, right? Or any witnesses or any type of such techniques we have to apply related to legal aspects, or legal aspects for a psychiatric patient. What are the legal responsibility for a psychiatric patient? So for that purpose we need to understand legal psychology. Next is about military psychology. Already I have discussed about military part, how we are dealing with the pure branch. So this is also an applied branch as well. In both branches it comes. Okay. So already the same point only, how to help our soldiers. The same discussion only. So these were about our branches or field of psychology. Like I have told, there are two types of psychology. First one is pure branch and second one is applied branch. Next is about methods of psychology. So, which are the methods? Methods means how we can assess patient. Okay, अगर हमें किसी को समझना हो, or what we can do to them. So, सबसे पहले we will just see observation method. Okay, so in the observation method, the first one is known as introspection. Since beginning of this class, I am telling about introspection. Intro means internal. अंदर की बात है. सो इंट्रोस्पेक्शन, स्पेक्शन मतलब इंस्पेक्ट करना, टू विजुअलाइज समथिंग. सो यू हैव टू सी योरसेल्फ. सो दिस इज द फर्स्ट स्टेप. वी हैव टू लुक विद इन सेल्फ, और ऑल्सो वी नोन एज सेल्फ ऑब्जर्वेशन. You have to observe ourselves. Unless until we don't understand ourselves, we don't see ourselves, we cannot see anybody else. This is the true principle of psychology, right? So for example, here it is given, a patient is telling about pain. So that is the subjective phenomena. Only patient can say about his pain. I cannot see his pain. I can just see his facial expression. जब pain होता है उसका facial expression में थोड़ा changes दिखेगा. Maybe he's like sad, he may be crying. So that's the only thing I can understand, he is in pain. But that pain, exact feeling, only that person can understand. So that pain is a feeling, it comes from within. The same way, introspection method also feel like whatever we are observe, analyze, our feelings, our thoughts, everything is based on ourselves. We have to understand our thinking. What I am thinking right now. Like when I am teaching you, so you are listening to me, or whether there will be any doubt. So many things are going inside me. So whether my thought will going to disturb me, if I get disturbed, it will definitely going to disturb my class. So this type of understanding, if you have, definitely we can understand our patient. But one many important point, you have to just see like a main point. That's why I put star. This cannot be used by any children or animals or mental defectives, because they cannot introspect. Do you think any animals like cat, dog, उनके अंदर सोचने का skill है क्या? Animals के अंदर, जानवर, they cannot do ना. Only human beings can think. So that's why they said, or any mental defective, those who are having mentally disorder, mental illness है किसी को, और वो ऐसा बीमारी चल रहा है, so मानसिक बीमारी हम कहते हैं. So if they are not normal, how can they become like a normal in person, like thinking or perception, intelligence? Nothing will be worked out. So they cannot understand themselves. If you ask a mentally ill person, if definitely they don't have insight आर यू मेंटली इल, अगर हम किसी से पूछते हैं आपको मेंटली कोई दिक्कत है क्या, सो अगर एक पेशेंट को कभी लगता है कि मुझे डिप्रेशन है सच में, दे विल एक्सेप्ट यस आई एम हैविंग सम सैडनेस, मैं डिप्रेस में हूँ. सो दे आर हैविंग सम इनसाइट. इनसाइट मीन इनर साइट, अंदर को खुद को जानता है. सो दे आर वेरी इजी टू ट्रीट. ऐसा पेशेंट को ट्रीट करना बहुत ईजी है. लेकिन आप देखो अगर कोई ऐसा बोलते नहीं मुझे कोई प्रॉब्लम नहीं है, मैं मेंटली बिल्कुल फिट हूँ, मेरे को जबरदस्ती हॉस्पिटल लेकर आया है, सो सच पर्सन देयर इनसाइट इज वेरी मच पुअर. They cannot understand themselves. Okay, so for this purpose we do introspection. Next is about observation method. Observation method, it speaks about objective observation. Do you know what you mean objective? Objective and subjective, these two things are there. Subjective means I, me, ourselves, myself, how I am understanding myself. Like मैंने अभी पीछे जो example आपको कहा pain का, so patient is telling I am in pain, that is subjective phenomenon. I use that word subjective, right? तो subjective means मैं अपना pain को मैं ही खुद समझ सकता हूँ, लेकिन objective means somebody is observing you. If I am a nurse and observing you, मैं आपको observe कर रहा है and I am finding my report, I am writing, analyzing everything, then it is objective. Like मेरा patient ने मुझे कहा I am in pain, अगर patient ने कहा मुझे pain है, दर्द है, if I am seeing them and I am looking to them, मैं उनके facial expression को देख के अगर समझ सकता है, then it is known as objective observation. और बहुत सारे example इसके अंदर है like temperature, pulse, blood pressure, पेशेंट का फेशियल एक्सप्रेशन. सो ब्लड प्रेशर, किसी का बीपी हमें असेस करना, दिस इज ऑब्जेक्टिव ओनली. पेशेंट कैन नॉट से आई एम हैविंग ब्लड प्रेशर अनलेस अंटिल दे डोंट हैव दैट मशीन. और टेम्परेचर देखना है, दोस ऑल आर ऑब्जेक्टिव ऑब्जर्वेशन. द सेम वे व्हेन वी वांट टू यूज टू स्टडी दिस टू एनी चिल्ड्रन, फॉर चिल्ड्रन का या मेंटली सिक है, अनकॉन्शियस है, जो बेहोश है, वो अपने खुद को नहीं जान सकते, तो हमें ऑब्जर्वेशन करने, वी हैव टू फाइंड द रिपोर्ट एंड वी हैव टू apply all those techniques how we can help this patient. So this is the another method of psychology. Next method is experimental method. Very important method because I already told you in the last previous slides, like people used to, I mean the psychologists used to, like John Watson या फिर Ivan Pavlov, they used to do many experiments on animals like a cat, a rat, a dog. आगे के कुछ क्लासेस में आएंगे आपको अंदर की हाउ दे डिड द एक्सपेरिमेंट, यू नो. सो व्हेन दे डिड एक्सपेरिमेंट दे अंडरस्टूड बिकॉज दे फेल्ट दैट एनिमल्स एंड ह्यूमन बीइंग हैव सम और अदर सिमिलर टाइप ऑफ एक्शंस. सो द सेम थिंग दे हैव do or they did the studies under controlled conditions, under their control in the laboratory. They did the study and they found, okay, these type of things are in psychology. So they are conducted on animal like learning. Learning के अंदर उन्होंने कुछ study किया है. I don't want to explain that part here. Simple, I can just say one simple example like a dog. So they have just studied how the dog is learning something. I'll tell this part in your unit 3rd, but still I just want to clarify here. You can write in your exam like example. You know, in psychology when you write example, you get more marks. You can score good marks because the examiner also will understand that student knows something. That is why they have written something good. So you can just write like, for example, the learning as I was telling. So there is a theory known as conditioning theory. So there was a dog. Okay, so he did the experiment. The theorist's name was Ivan Pavlov. So he just did the theory on dog, that he gave some food to dog. So dog was salivating. डॉग का सलेवा आ रहा था. सो जैसे फूड देखा, द डॉग स्टार्टेड सलेवेशन बिकॉज दैट फूड हैव ए कनेक्शन विथ हिज physiology, that is the connection, that is the response and stimuli. So जैसे उसको समझ आया, फूड के साथ उसको सलेवेशन होता है. धीरे धीरे उन्होंने क्या किया, एक नया टेक्निक ऐड किया. दे जस्ट एडेड वन न्यू टेक्निक दैट इज लाइक अ बेल. सो एक बेल ऐड किया, जैसे एक बेल बजाते हैं तब गाना आएगा साथ में. तो डॉग वॉज वेरी हैप्पी, लाइक डॉग वॉज वेरी लाइक एंथुसियास्टिक, लाइक जब बेल बजाएगा मुझे खाना मिलेगा. So like the dog started thinking about, not thinking, I can say dog started about waiting, when the bell rings I get the food. But suddenly what happens, you know, like dheere dheere gradually what happens, he only rang the bell but no food, still salivation was coming. How it happened? Learned, because they have learned something. उन्होंने सीखा, dog has started learning that if bell gets ring I'll get food. So this type of new learning technology they have applied with the animals. Next is about clinical method or case history method. So clinical method is mainly used for hospitals or in educational settings or case history. अगर नया कोई पेशेंट आया मेरे पास, लाइक फॉर एग्जाम्पल इफ इट इज अ डिप्रेसिव पेशेंट, सो आई वुड लाइक टू टेक हिज हिस्ट्री फर्स्ट. व्हाट हैपेंड टू हिम, what is his present condition, what was his past history, what are the present signs and symptoms, what is showing, what was his chief complaints. So patient's complaints as well as relatives complaints or his mother, parents, whoever is going to give, all these complaints will same whether I am going to get reliable information. So those information, those history collection is very important. Then only I can treat the patient. अगर हम दूसरे फील्ड में अगर देखेंगे, जैसे किसी को मेडिकल इलनेस है और किसी को जैसे कि फीवर हो गया या किसी को रेस्पिरेटरी इश्यू है या कोरोना सिम्टम्स है, सो दिस कोई भी सिम्टम्स या सर्जरी कराना है, सो वो सिम्टम बेस पे काम चलता है. बिकॉज नाउ दे आर शोइंग दिस सिम्टम, फीवर है तो फीवर के लिए एंटीपायरेटिक दे दो, या उसको रेस्पिरेटरी इश्यूज है तो रेस्पिरेटरी ट्रीटमेंट स्टार्ट करो. बट फॉर साइकियाट्री इट कैनॉट वर्क, because we should know the history of the patient, past history, present history, when he started the symptom, how the symptom is progressing, what is the frequency, duration, the pattern of his symptoms, everything. That all case study we have to do, and then we can get the final treatment for that patient. For that purpose, you should get the information from parents, siblings, friends और रिलेटिव्स और नेबर. सिबलिंग्स मतलब उसका भाई बहन जो भी है. सो इन लोगों का किसी से भी हमें इंफॉर्मेशन लेना पड़ेगा. दैट वुड बी द सेकेंडरी डेटा. प्राइमरी डेटा विल बी पेशेंट. द फर्स्ट इन्फॉर्मर शुड बी पेशेंट, बट पेशेंट मे नॉट गिव यू करेक्ट इन्फॉर्मेशन, राइट. तो समटाइम्स क्या होता है, साइकियाट्रिक पेशेंट है तो उनका इन्फॉर्मेशन कभी कभी उनके रिलेटिव्स या कोई भी और दे सकते हैं. Next is about survey method. The survey method is also a very important method because here we have to gather the information to large number of people. You might have experience like when you go somewhere, the people used to give some type of test. Maybe they may test your emotion, aptitude, or like questionnaire, checklist, rating scales they may give. Rating scales, for a simple example, I can show here rating scale. Like there may be like a scale. Okay, you may learn in your further classes also. Like for example, I will put some numbers here, 1 0 1 2 3, yeah, maybe 4. Like this is like a 5-point scale. Okay, 1 2 3 4 5 point I have put here. Here there will be some items. Okay, so suppose if I am writing here, sir's class was good, sir's class was understandable. If I am writing here, my class was understandable. Okay, then I will ask, I will give this rating scale to you. You have to tick mark. 0 means poor, 1 means average, 2 means good, 3 means very good, and 4 means excellent. So you will tick which is suitable for you. This is rating scale. So like this, we can have many number of question, number 2, number 3, like that. The same way in the psychology also, they have such type of rating scale. For example, if I want to assess depression, अगर मुझे कोई ओल्ड एज होम में जाना है, वहाँ ओल्ड एज पीपल में बीच में कितना डिप्रेशन पेशेंट है या कितनी मेंटली अनस्टेबल पेशेंट है मुझे देखना है, एक सिंपल सर्वे आई कैन डू. ओके, आई कैन जस्ट प्रिपेयर माई क्वेश्चन. उस क्वेश्चन को ऐसे में बांट सकता है, डिस्ट्रीब्यूट कर सकते हैं. देन आई विल आस्क देम टू पुट टिक मार्क्स एंड फाइनल आई विल डू ऑल द कैलकुलेशन. देन मुझे पता चलेगा कितना डिप्रेशन है, वेदर इट इज वेरी माइल्ड डिप्रेशन या मॉडरेट है, बहुत हाई लेवल में डिप्रेशन है. सो दिस इज लाइक अ सर्वे. So survey type can be done in many ways, so that will also get more information from more people. Large number of people में हम use कर सकते हैं survey. Another method is genetic method, is like known as developmental method to understand the growth of the behavior, like learning behavior of the child or adult, how the adult is learning. If I want to assess your behavior in the class, when you are learning from this video, how you are doing the class, so I can do some studies. Or like childhood, how you are in childhood, how you are in now, like that. Next is about testing method. So testing method, like various tests are available, like attitude, interest, ability, intelligence, personality. These all tests. Okay, you will learn these details in your further classes. Like a personality का एक अलग unit है, unit number 5. There you will learn about personality test. किसी का personality कैसे assess करें, किसी का attitude देखें, किसी का intelligence हमें check करना है, कितना IQ है उसके अंदर. तो उसके लिए हम ये method apply करते हैं. So that was about methods of different psychology. Okay, how to understand the patient. Next topic is important, how we can relate this subject. Almost we have covered about this part, but it is little bit different also, like psychology and biology. क्या connection है? Biology आपने 12th में पढ़ा रखा है. So biology मतलब understanding the human body. Same in your first year, you have the subject like anatomy, physiology. So what you are going to study in anatomy and physiology? In the anatomy, you will study about human organisms or the function, maybe my heart or my muscles or my blood or my kidney, how it's going to function. So how this can be connected with psychology. Okay, like for example, if I want to study about my brain, so brain is related to, ultimately related to your psychology, because brain have various function. Your memory, आपका यादगार, तो you are continuously memorizing something. आपका सोच, like thinking, or the learning, I am learning something. Okay, I am judging, judgment, मैं किसी को judge कर रहा हूँ. These all functions are from the cognitive functions, and ultimately who is controlling? Brain. So this is the connection between biology and psychology. Okay, next is about psychology and sociology. Sociology का मतलब है social ऑब्जेक्ट्स को समझना, सोशलाइज करना, किसी को स्टडी ऑफ समथिंग रिलेटेड टू ऑर्गेनिजम्स, रिलेटेड टू सोशल बिलीफ, सोशल थिंग्स, कस्टम्स, ट्रेडिशन, इंस्टीट्यूशन. आपको एक सब्जेक्ट है सोशियोलॉजी इन योर नेक्स्ट ईयर. सो देयर आल्सो विल लर्न लाइक किसी का फैमिली, मैरिज या ट्रेडिशन, कल्चर, सोसाइटी, ग्रुप डायनामिक्स. ये चीज़ को आपको समझने के लिए यू नीड सोशियोलॉजी सब्जेक्ट, एंड देयर यू कैन कनेक्ट विद द साइकोलॉजी. Next is psychology and philosophy. Philosophy is related to knowledge, your wisdom. Okay, something like आपको पता है doctorate होता है philosophy, doctorate of philosophy, PhD जो कहते हैं. So they are very much knowledgeable. Philosophers, you know, like Swami Vivekananda is a great philosopher. Abdul Kalam, we consider him as a philosopher. Mahatma Gandhi, Rabindranath Tagore. So ये सब great philosophers है. तो उन्होंने कुछ philosophies बनाया है, wisdom, the knowledge related. So those part can be connected because psychology is interested in individual. Like in philosophy, everything it covers about the universal mind. Next is about psychology and psychiatry. Already I told about the difference between psychology and psychiatry. Psychiatry is about the disorder. Psychiatry is the medical specialty which is only study about the mentally ill. Mentally ill person के बारे में जो सीखना है, mentally unstable है, वो physically healthy होगा लेकिन mentally stable नहीं है, तो उनका क्या बीमारी है, जैसे मैंने डिप्रेशन कहा, या फिर स्किज़ोफ्रेनिया होते हैं, मैनिया होता है, बहुत सारी बीमारी है जो आप धीरे धीरे सीखोगे. एवरीथिंग कैन नॉट बी टीच इन अ स्ट्रेच, बट टू अंडरस्टैंड देयर abnormal things you first know about their psychology. That is very important, right? So psychology and psychiatry, this is ultimately different. Psychology studies about normal behavior, psychiatry studies about abnormal part of it. And psychiatry बनने के लिए psychiatrist होना चाहिए. Psychiatrist means a doctor who have that degree of psychiatry. They must be PG, postgraduate in psychiatry, and they should be able to treat the patient of psychiatric illness. Now the last part is about nursing in our profession. कभी कभी ये भी क्वेश्चन आ सकता है आपको, why nursing people have to study psychology? Why it is relevant? नर्स को क्यों जानना चाहिए साइकोलॉजी? द फर्स्ट पॉइंट इज द साइकोलॉजी विल इनेबल नर्स टू अंडरस्टैंड देमसेल्व्स. Already I told you introspection, right? In the methods of psychology, you have to understand yourself. जब तक आप खुद को नहीं समझ सकता, यू कैन नॉट अंडरस्टैंड एनीबॉडी. सो साइकोलॉजी सब्जेक्ट जब हम पढ़ोगे, लाइक आगे आगे जो चैप्टर्स आएगा, यू विल ऑल्सो वंडर मेनी थिंग्स व्हेन आई विल गिव एग्जाम्पल्स. अच्छा, ये तो मेरे साथ भी होता है ऐसा. काफ़ी एग्जाम्पल जब मैं शेयर करने वाला हूँ आपके साथ, सो यू विल अंडरस्टैंड, येस दिस इज वेरी इंपॉर्टेंट टू अंडरस्टैंड. सो जब खुद को आप समझ सकते हैं, यू कैन अंडरस्टैंड पेशेंट, मे बी नर्स का मोटिव, डिजायर, इमोशन, एवरीथिंग यू कैन अंडरस्टैंड. हाउ द स्ट्रेंथ एंड वीकनेस, मेरे अंदर क्या पॉजिटिविटी है, क्या नेगेटिव है, where I need to improve, only my psychology can tell myself. Unless and until if I am taking you a class as a teacher, I should criticize me first. I should give feedback to me. If I should improve somewhere, और मुझे कहीं improve करना है, ये नहीं करना है, ये what are my strength or what are my weakness. So these all things are basis of a psychology. Next is psychology will help nurse to understand other people. Already I told you, unless until if you don't understand yourself, you cannot understand anybody in front of you. Maybe your patient या patient का relatives या patient बहुत serious patient है, suppose chronic patient है, admit in ICU suppose, okay, so their psychology is very down, they are very depressed, maybe they are unconscious, वो बेहोश भी हो सकता है, उनको कुछ पता ही नहीं होता है, and we know that they are very serious, शायद उनका death भी हो सकता है. And what about the relatives जो बाहर है? So जो relatives बाहर वेट कर इंतजार कर रहे हैं हमारे पेशेंट का, so we have to understand those people's emotion as well as, but mind it, you should not deal or you should not dealt like in a very like incorporate into their life too much. हम ज़्यादा इन्वॉल्वमेंट भी नहीं होना है उनके साथ, बट स्टिल वी कैन गिव राइट इन्फॉर्मेशन टू दम एंड वी कैन जस्ट टेल दम पेशेंट का कंडीशन इस तरह का है, कुछ नहीं होगा, मतलब हाउ वी कैन केयर दम, all that psychological support we can give. So this is we are understanding, because we should have that empathy towards them. You know what is empathy? So empathy is very important. Empathy and another term is sympathy. You should know the difference between these things. And being a nurse, we must have empathy. Empathy means putting ourselves into other situation. अपना मतलब अपने को किसी और के जगह हमें ढाल के देखना है. सिंपल उसके लिए फ्रेज ऐसा कहते हैं, पुटिंग आवर लेग्स इनटू अदर्स शूज, दूसरों के शूज में अपने पैर डालना. उसका मतलब ये है कि किसी और का कोई प्रॉब्लम हो, हमें उनका प्रॉब्लम को अपना समझना है, हमें उनके जगह सोचना चाहिए कि व्हाट इज देयर प्रॉब्लम, इफ मैं इस तरीके का सिचुएशन में होता मैं कैसे डील करता. सो दैट एम्पैथेटिक अंडरस्टैंडिंग हमारे अंदर होना चाहिए. बट सिंपैथी इज जस्ट डिफरेंट. सिंपैथी मीन्स जस्ट हैव ए मर्सी फील, ए पिटी फील, लेके दया आना किसी के लिए, जो बेचारा ऐसा हो गया उसको. सो दैट ओनली दैट फीलिंग वी हैव, बट वी are really putting ourselves into their situation, and understanding is empathy. So that empathetic approach is very much important in this psychology. So that is why we have to understand that patient. Some points I give some based on my own experience or my reading experience. So you can note that examples also, because in your exams you need to write examples so you can score good marks. Next is psychology will help the nurse to improve situation by helping others and solving problems. How we can help others? Okay, like for example heart disease है, किसी को कैंसर है, they need more coping skills, they need more health care, because they don't know about dietary pattern, because they know the cancer है मेरे को, या मेरे को हार्ट का प्रॉब्लम है, हार्ट हैव सम ब्लॉकेज. सो हार्ट कैसे ब्लॉक हो गया तो वहाँ का ब्लड सर्कुलेशन बराबर नहीं है. सो व्हाई दिस इज हैपन, मे बी माई लाइफस्टाइल, मेरा लाइफस्टाइल में दिक्कत हो सकता है, मेरा डाइट, मेरा ड्रग्स और मेरा एक्सरसाइज कहीं ना कहीं मेरे अंदर प्रॉब्लम है. सो बीइंग ए नर्स वी शुड अंडरस्टैंड देम, वी शुड एज ए नर्स वी कैन गाइड देम, वी कैन प्लान ए डाइट फॉर देम. डाइट के बारे में हम बोल सकते हैं, जैसे आपके अंदर न्यूट्रिशन सब्जेक्ट है, सो यू विल लर्न अगेन इन डिफरेंट टाइप ऑफ, लाइक कार्डियक में कौन सा डाइट देना है, और लाइक किडनी डिसीज में कौन सा देना है, डायबिटीज वालों को कौन सा देना है. बट एट द सेम टाइम लाइफस्टाइल को कैसे मैनेज करें. अगर मेरे अंदर कोई स्ट्रेस आया, सो हाउ आई शुड मैनेज माई स्ट्रेस. सो धीरे धीरे यू विल लर्न दिस ऑल थिंग्स, स्ट्रेस मैनेजमेंट टेक्निक्स, मेडिटेशन करना, योगा करना. सो हाउ दिस हैज टू बी अप्लाइड. सो दिस इज वन एस्पेक्ट टू हेल्पिंग देम टू कोप विथ देयर सिचुएशन. और जो एजुकेशनल साइकोलॉजी के अंदर ऑलरेडी ट्रेंड है, दे कैन बिकम ए गुड हेल्थ एजुकेटर, दे कैन अंडरस्टैंड द पेशेंट विथ द बेस्ट सोशल सपोर्ट who are hospitalized. Like मैंने अभी एग्जाम्पल बताया था, ICU patient है, so the patient is admitted inside and the relatives or the main person, significant persons are waiting outside. They are really worried, no, what happened inside, या बहुत ज़्यादा सीरियस है, तो हमें बाहर आके उनके साथ सोशलाइज करके उनको भी हमें गाइड करना चाहिए. एंड द नर्स इन द कम्युनिटी सेंटर्स, यू नो इन द कम्युनिटी लेवल ऑल्सो देयर मे बी सम हॉस्पिटल्स, कम्युनिटी स्वास्थ्य केंद्र होता है, लाइक PHC, सब सेंटर, प्राइमरी सेंटर, कम्युनिटी सेंटर. वहाँ पे भी हम मेंटल इलनेस को पहले से जानो, कोई मेंटल इलनेस या मेंटल केस को आ रहे हैं. काफ़ी जगह ऐसे होते हैं जो गांव में रहते हैं, रूरल एरिया में, दे डोंट हैव दोस कॉन्सेप्ट अबाउट मेंटल इलनेस. जैसे कोई बीमार है, मेंटली इल है, तो उनको घर में बंद किया जाता है. पहले ज़माने में होता था, लेकिन आजकल थोड़ा पीपल आर लाइक एजुकेटेड, दे स्टार्टेड गोइंग टू ट्रीटमेंट. बट डेफिनेटली बीइंग ए नर्स वी शुड मेक पीपल अवेयर अबाउट दैट दे शुड गो फॉर ट्रीटमेंट, नॉट ओनली लाइक दे हैव टू सप्रेस, या किसी को शेयर नहीं करना है, किसी को छुपा के रखना, मेरे को मेंटली प्रॉब्लम है. नो, जब आप शेयर करोगे, when you become sharing, definitely you can guide them. Then they can help people to prevent mental illness, how to deal with stress, anxiety and other life problems. Next, how to understand body, mind and spirit. Anyway, in your next unit, इसके बाद जो unit आएगा, that is about body, mind and spirit, there you will understand how the emotions are going to affect their body and will recognize the same in their patients. Patients के अंदर भी कैसे emotion को understand करना है and how to understand self emotion. For that purpose, you need to understand about my body. Sometimes happens if I am very टेंस्ड, अगर मेरे अंदर कोई टेंशन है तो मेरे बॉडी में वो चेंजेस आएगा. माई बॉडी कैन शो दैट चेंजेस, दैट इज माई इफेक्ट ऑफ माइंड ऑन माई बॉडी. लाइक फॉर एग्जाम्पल, इफ आई एम इन टेंशन आई मे गेट हेडेक, मेरे को हेडेक हो सकता है, या मुझे नींद कम आता है, इंसोम्निया कहते हैं इसको, या मुझे डायरिया हो सकता है. सो दैट इज इफेक्ट because my mind got disturbed. So these relationship you must be understood. Then how to help the student to appreciate the necessity for changing the environment or surroundings, because you always help the students for better adjustment. Psychology students को भी थोड़ा मदद करते हैं. Like जब आप पहले जब कई कॉलेज में एडमिशन लेते हैं, सो आफ्टर 12th यू हैव टुक द एडमिशन, राइट. सो समटाइम्स यू हैव होम सिकनेस. काफ़ी लोग जैसे घर से दूर है, वो हॉस्टल में रह के पढ़ रहे हैं, सो उनको होम सिकनेस हो सकता है. सो देयर इट इज़ वेरी डिफिकल्ट फॉर यू टू गेट एडजस्ट. आपको एडजस्ट होने में थोड़ा तकलीफ हो सकता है. सो दैट हैज़ टू कम इन कंट्रोल. धीरे धीरे आएगा. व्हेन यू विल बिकम गोइंग टू हॉस्पिटल, जब आप फर्स्ट ईयर में, जब व्हेन यू आर कमिंग टू कॉलेज, यू विल हैव थियरी ब्लॉक. Then after some months, maybe 4, 5 or 6 months के बाद you will be posted in hospital. So that time also you have some type of anxiety होता है, एक नया environment है. So how to get adjust to that. So but you will to get to adjust because you need to understand about your psychology. And readjustment. Readjustment means how to readjust yourself. As I said, homesickness, already I told you how to understand, because I am away from my home. Like in 12th, till 12th I was in school, now I am in college. तो college का life अलग है, school का life बिल्कुल अलग थे. So how to adjust with this readjustment, or adjusting to a sick person who may cry or desperate, even ventilate their anger by nurse, मेकिंग ए नर्स टारगेट ऑफ दर अब्यूज एंड कर्स. समटाइम्स ये हो सकता है कोई पेशेंट बहुत ज़्यादा दुखी में है, वो रोता है आपके सामने, तो आपको उनको सपोर्ट करना चाहिए. कभी कभी पेशेंट के ऊपर वो गुस्सा दिखा सकते हैं, बट यू कैन नॉट शो दैट एंगर टुवर्ड्स दम, but you can just wait for some times, or you can just make them more understand. You also should not be very emotional to them. You should take time, otherwise they will get provoked to that, no. Then trying to work and study together. Understand the situation and study together. Be in group. You understand among yourself. एक unity में रहो, so you can share each other. So that also helping only through psychology. So that is about this, and last part is about importance of psychology in nursing. Already the same point only. Just now we have covered about how the psychology subject is important in nursing, और some more additional points. अगर आपका क्वेश्चन कोई ऐसे क्वेश्चन आ गया तो आप ये भी पॉइंट्स आप लिख के you can get more marks. Like how the nurse focus on helping people recovering from any chronic illness, as I said about cancer, या heart है, या जैसे आजकल corona is very common. So this type of illness है, how to get out of this, and they have to get, जैसे I told in some previous slides, WHO World Health Organization ने ये कहा कि आने वाले समय में depression would be the major disorder. Why depression? Depression क्यों है? Because of some major physical problems, maybe cancer और हार्ट का इश्यू, ये कोई इश्यू के वजह मैं डिप्रेशन में जा सकता हूँ. So I should understand, I should teach the patient, I should be very emotionally support to the patient for a speedy recovery. Then physical problem को मुझे ठीक करना है, I should be very compassionate to them. मुझे भी उनके साथ compassion होना चाहिए, empathy होना चाहिए. Like as already told about difference between empathy and sympathy, right? तो I should understand in their situation. उनके जगह में होता तो मैं भी कैसे feel करता. So that compassion we should have, empathetic approach. You should listen them. You will learn, like when you are talking to a psychiatric patient especially, yeah, those who are already down or those who are already have hopelessness, you just have to listen. Just listen their problems. You should not interfere in between. बीच में उनको block मत करो. पूरा आप सुनो उनकी बात. Then after once you listen their issues, then you give some solutions to them. then you should not diagnose mental or psychological, instead you only assess the patient. जैसे कोई पेशेंट ने आपसे कहा मुझे ये प्रॉब्लम है, डायरेक्टली उनको बोला आपको ये बीमारी है, आपको स्किज़ोफ्रेनिया है, या आपको सुइसाइड का टेंडेंसी है, या आपके अंदर मैनिया है, या आपके अंदर कोई चाइल्ड साइकेट्रिक डिसऑर्डर है. नो, नेवर. You just understand, make them to understand about that disorder, and you can just distribute your care. You can just give more assistance to them. And last is professional psychotherapy or counseling is not part of nurses' prime duties. Neither you should have psychological expertise. We can counsel the patient, no issue, but we cannot counsel based on their diagnosis. और ऐसा नहीं कि अपना काउंसलिंग से पूरा ठीक हो जाएगा, because we must have that expertise. आजकल लोग उसके लिए काफ़ी कोर्सेस करते हैं. You can also go after your nursing also. You can do some additional course. अगर आपको साइकेट्री में वगैरह ज़्यादा इंटरेस्ट है, तो साइकोथेरापी में कोर्सेस है, काउंसलिंग का कोर्सेस है, मे बी ऑनलाइन और इवन ऑफलाइन कोर्सेस भी चलता है, डिग्री डिप्लोमा कोर्सेस यू कैन डू एडिशनली. सो दैट ऑल्सो विल बिकम, यू विल बिकम मोर एक्सपर्ट. सो बिकॉज काउंसलिंग करना इज ऑल्सो टेक्निक, एक टैक्ट, एक स्किल है. सो फॉर दैट पर्पस यू नीड टू अंडरस्टैंड दिस. Can you just see this image? Okay, just last हो गया हमारा जिस part को. So this part is over. So just एक image है यहाँ पे. You have to just count the number of faces in this image. In this image, just I want to see how you are going to observe yourself. Just in homework, though we are not in live session here, just you count the number of faces in this image. So you can just be more concentrate, your attention, your ability to perceive something, your judgment, learning, memory, everything gets applied. That is observation, right? So unless until you cannot observe anything, you cannot become a good nurse. So this is the best part of this unit. And some important questions already I told you which are the basic questions generally asked for exams, like define psychology, what are the scope or branches, methods of psychology, and importance of psychology in nursing. These 4 questions are very important, but some more questions I have added, like how this psychology can be related with others field of study. Already I told you biology and psychology, psychology and sociology, like that. Then Hippocrates ka jo for humors I have taught you, that for humors contribution also they can be asked you. So here we are completing with our unit 1. Thank you.